Hi, I'm Melissa, and I'm one day out from revision rhinoplasty with Dr. Lamb. I saw him on TV, I think on Good Morning Texas, and then I looked on the internet and got some information on him and found some really good reviews and references for him. And I had my first surgery 5 years ago in Atlanta and couldn't breathe after that, and had the cartilage graft starting to poke out of my nose, so that's why I came to Dr. Lamb. And I have absolutely no pain at all, and the last time at that surgery I had a lot of pain and felt like I'd been hit by a truck, so it was quite a shock to get home yesterday and feel totally normal, even though I don't look totally normal. And even though I have a lot of bruising, it's a lot less than the last surgery where my whole face was bruised.
As you heard from Melissa, she is now one day out from having the revision nose done. You know, she does have a little bruising under the eyes, and these will get a little bit darker over a week. And I can be very honest with you, this is extremely rare that I even see a little bit of bruising after a rhinoplasty. This was a very difficult revision nose. Turn over this way so I can just show you that I did harvest some ear cartilage graft, and turn back toward me. Let me tell you what I saw during the procedure. One is the thing that really bothered her was that she had a shield graft, a type of graft that I usually do more in Asian noses where it's a thicker skin type, and more uncommonly in Caucasians because of potential that showing up over a few years. I took that graft out for her that was visible, and also made her tip hang a little bit too much from an aesthetic perspective. The other thing, I couldn't understand why she couldn't breathe, but when I opened everything up and looked in there, the cartilages had been cut through almost like what it's called a Goldman tip, and that had literally let all the sidewalls fall inward. So I rebuilt all that area to help her breathe, and she told me now that she was amazed at sleeping at night. She couldn't even breathe with her mouth closed, which to me is exciting. And then if any of you guys know about what the Romanesque architecture is like with the flying buttresses, I recycled it recycled her graft from her nose that was not good, and also used some of the ear cartilage to actually support the wall of that cartilage. So not only did I reinforce and recreate that wall, but I put a little strut graft going out to the sides to help build the strength of that. Because when she came to see me, she said, I can't breathe when I just pull out the bottom part of my nose. So I knew something had been cut there. And the good thing is all those grafts are hidden underneath the cartilage, so these will not show up in years to come, which is obviously a concern. But she should have a great result with this, both from a aesthetic perspective and also from a functional perspective. So some of the things that perhaps will be easier for a surgeon to convey. And again, this is a little bit more swelling and bruising that I usually see in most of my patients, even in a revision setting. And again, we're one day out from the procedure.
Okay. Hi, I'm 7 days out past my rhinoplasty revision, and the healing is going very well. My ear's been a little sore, but my nose hasn't been sore at all. And compared to the last one, it's like night and day.
As you heard from Melissa, she is now 7 days out. A little soreness in the ear is normal after a revision nose when you have to take ear cartilage to reconstruct and rebuild the tip. This is a lot more bruising, if you can believe, than I usually see in most of my patients, but I think it's worth seeing some bruising that can happen with any procedure. Her tip does look swollen. This is a very difficult revision nose that I did in terms of getting the structure back so she could breathe. The nose doesn't hurt at all, right, Melissa? It doesn't hurt at all? It shouldn't. Noses don't hurt. I would say that a fraction of my patients maybe have a little discomfort the night of the procedure, maybe some soreness, but that's usually due to some congestion and a sinus headache. But in terms of discomfort, the nose doesn't hurt. The ear usually is a little uncomfortable the night of the procedure, and there may be some soreness for a few days, but I rarely have to use ear cartilage. The only time I have to use ear is if there's literally no cartilage left for me to do my job, and that was the case in this situation. But everything is going very well. It's 7 days out, so we're going to go ahead and end this journey just to see where Melissa is, and maybe we'll follow her in the future.